Hello, everyone. My name is Jane Estes, and I am the Knowledge and Development Manager for ISPCAN. We'd like to thank you for joining us today for our ISPCAN Article of the Year Journal Club. ISPCAN monthly journal clubs recognize author excellence, innovation, and advancements in the field of child abuse and neglect. Authors keep us learning and pushing the boundaries of research and practice to get better data, prevention, funding, policies, and systems of care to improve child protection. Thank you for joining us as we hear from the authors of our 3 award-winning articles. These award-winning articles are from Child Abuse and Neglect, the International Journal. Our article of the year, a spatiotemporal analysis of the impact of COVID-19 on child abuse and neglect in the city of Los Angeles, California. We'll also be presenting our honorable mention article, using social media data for assessing children's exposure to violence during the COVID-19 pandemic. And our third honorable mention article, Violence Against Children During COVID-19, assessing and understanding change in the use of helplines. Some tips for making the most of today's session. Please engage with us. As you listen to the presentations, make note of your questions and comments to share at the Q&A session that will take place after each paper. Please take a moment to introduce yourself to other attendees, to our ISPCAN team, and to our presenters in the chat box. We'd like to know who you are, where you're from, and why you joined us today. And for joining today, a recording of this panel discussion, the presentation slides, links to the featured articles will all be sent directly to you after the webinar, as well as the certificate of attendance. Our goals for today's session is to hear directly from the authors of these 3 award-winning papers, to share takeaways from these papers that may encourage future research, and to discuss the implications of this research for child maltreatment and child welfare practice, specifically taking data to practice. As you listen to the presentations, take time to note your questions in the Q&A box so that they can be asked directly to our authors immediately following their presentations. We will have a 10-minute Q&A session at the end of each paper before we move on to the next author presentation. And with no further ado, I would like to introduce our article of the year. This article was co-authored by Dr. Gia Barbenzoa Salarino, assistant professor at The Ohio State University. Dr. Salarino's scholarship focuses on the multiple contextual influence of risk, i.e. traumatic experiences, and protective factors, such as social networks, associated with adverse child experiences, focusing on vulnerable populations. Her research goal is to reframe existing narratives to empower communities using big data and a broad range of statistical and geospatial methodologies. In 2020, Gia was co-PI on a grant from the National Science Foundation to estimate the unintended consequences of policy interventions and disparities related to the COVID-19 pandemic. Gia, we look forward to your presentation, and at this point, I turn it over to you.
Thank you so much. Could everybody see my slides okay, Jane? Is that okay?
Yes, they look fantastic. Thank you.
Okay, you can hear me. Awesome. So first of all, I am so honored to be here. I know a number of my colleagues and the co-author of the NSF grant that was the impetus for this work is also on the call. So thank everybody for this wonderful honor and for being present today. The paper that we wrote is called Spatiotemporal Analysis of the Impact of COVID-19 on Child Abuse and Neglect in Los Angeles, California. And without further ado, I will begin the presentation. So the broader framework for which this paper represents a subset pertains to the spatial context using a public health framework to explore the most effective mechanisms for the prevention and intervention of harms to children. This involves basically and briefly reframing child abuse and neglect. The acronym that I will use throughout this presentation is CAN. So reframing CAN as a public health priority by focusing on the social, physical, and legal determinants of health. DOH stands for determinants of health. Social, physical, and legal determinants of health and well-being as root causes of trauma, violence, and abuse, using data and research to advance complicated issues with the lens of using innovative advanced methods, including geospatial analysis and big data to address important limitations of law and public policy as tools of prevention. Throughout this presentation, geospatial analysis of child maltreatment data refers to data on child abuse and/or neglect that is associated with a particular location. And the determinants of health are the conditions in which persons live, work, play, and access care that cause health inequities, particularly when access to resources are limited. When we started writing this paper, it was clear. It's a little traumatic to even recall the effects of COVID-19 on all of us, but it was clear at the time that COVID was going down as one of, if not the most important and significant medical and public health disasters that we've ever faced. As of April 26, 2020, there were already 883 COVID deaths in LA County, and there were huge disparities. As the chart on the left of your screen shows, as of April 26, 2020, the death rate for Native Hawaiians and Pacific Islanders in LA County was almost 12 times higher than the rate for non-Hispanic whites. As shown by the chart as well, there were disparities among the Latinx population and the African American population as well in LA County. Further, age-adjusted rates indicated a social gradient in both confirmed cases and deaths. The age-adjusted rates were more than 3 times higher for those who are living in high poverty areas as compared to low poverty areas. The map on the slide suggests how specific communities would likely recover or not from the health, economic, and social costs of the pandemic. The map shows that communities with higher index scores, this is the COVID Vulnerability Recovery Index, it's available on the open website for LA County. The index scores that are higher, that are shown in purple, show that some communities faced a greater risk of having a very long uphill economic, social, and health recovery compared to others. The map further shows that the communities with the highest level of need, again in purple, were located in predominantly lower income and communities of color. At the time we wrote this paper, we did not know the full effects of the pandemic, hence they're counterfactual, but these data suggested that the virus would become a leading cause of death in the county and have devastating impacts on distressed low-income communities, communities of color. These assertions, of course, we know are grounded in truth. They actually came true, unfortunately. In response to the COVID-19 public health crisis, the city and county of Los Angeles issued an emergency safer at home order, limiting activities outside of the home and mandating school closures. The effort to mitigate the health impact of COVID-19 exacerbated pre-existing neighborhood vulnerabilities that existed before the pandemic. For example, there was widespread unemployment, housing and food insecurity, unpaid sick leave, and lack of childcare widespread that further magnified the stress of the social isolation caused by the pandemic itself. The mitigation measures also inadvertently increased the risk of potentially life-threatening situations for vulnerable groups, particularly women and children who are now trapped at home in quarantine with their abusers. In short, COVID-19 created an urgent need to identify at an individual level those who are susceptible to family violence, women and children, and communities that were going to be disproportionately impacted by the mitigation policies and interventions and public health priorities. However, where was the data? The detection and classification capabilities of existing surveillance systems were a major hindrance. So there was just simply no data. At the time, data, real life, instantaneous. So we asked ourselves, that is my co-authors and myself, how can we leverage publicly available geo-referenced longitudinal data to be able to identify neighborhoods that lack the resources that are needed to respond holistically to this public health crisis that was created by COVID-19, and to identify at-risk children. It turns out that Los Angeles County has an amazing, one of the most comprehensive open data websites in the United States, and provides incident data in real time that enabled us to get up-to-the-minute information on child abuse and neglect across the city and over time. So at that point, there was simply no data to inform the issue of children at risk in their homes, but LA County provided incident data that was going to be able to have us inform this issue. In this paper, we combined that data, the incident data from the open data website, with multiple additional data sets to explore child abuse and neglect risk in the city, drawing heavily on spatial analysis for exploring the social and hence disease vulnerability to identify areas in need of resources. The specific methodology of the study was well suited to identify and interpret the impact of COVID on child abuse and neglect, and on the availability of social resources. That is, we used a socio-ecological perspective. The socio-ecological perspective focuses on the dynamic interaction between parents and children, that is the human environmental interaction, in the immediate and more distal contexts in which human behaviors occur. The more immediate contexts are, for example, home and schools. And the more distal and remote context would be, for example, the policy mandates and societal social attitudes towards COVID-19. It also incorporates the role of time and emphasizes how constellations of risk affect child well-being and adaptive strategies. So our methodology is consistent with the socio-ecological perspective because it illuminates the critical context and relevant factors for understanding CAN in the age of COVID. Such an understanding of note is at the heart of developing sensitive and effective interventions for child maltreatment. So in this study, using this perspective, we explored the impact of COVID-19 on CAN, focusing on the contextualization of the sources of stress that strain parent-child relationships. More specifically, our aims were threefold. One is to examine space-time trends, spatio-temporal trends, before and during the COVID-19 pandemic, to explore CAN risk across neighborhoods as filtered by neighborhood vulnerabilities that have only been exacerbated by the pandemic, and to map the distribution of risk factors that are most highly associated with CAN for the purpose of identifying the need for resource allocation during COVID-19. We used a broad array of variables from different data sources that we merged with the incident data on child abuse and neglect. The variables we selected were useful to address the impact on COVID because they're consistent with the ecological perspective. In short, it's the influences of different social and economic contexts, such as the availability of social services, changes over time in abusive outcomes, and a focus on outcomes both pre and during, or after, but I mean during the pandemic, and those influences on human behavior. So just briefly to kind of go through the variables that were included and merged with the accounts of child abuse and neglect. Demographic factors, the victim's sex, race, ethnicity, age, and the locus of where the harm took place. We used a birth asset score that is comprised of sub-indices: family, health, service utilization, and financial resources. These are things like indicators of poor birth outcomes for mothers. So if you were a teenager at birth, whether you had access to medical care, were there any complications in birth? Also financial resources such as access to healthcare, etc. We used a measure of school absenteeism, which was the percentage of students who were absent 10% or more of the school days in which they were enrolled. Poverty, labor force participation, percentage of population over 16 who are either employed or unemployed and actively seeking work. Housing affordability, defined as rent burden, where your monthly income of greater than 50% is going to pay your rent and or utilities, and also mobility indices, which measure adherence to the stay-at-home mandates. All of this data is open, freely available, public, Anybody can download it, and it also, again, is consistent with our overarching theoretical framework of the socio-ecological perspective. Briefly, just the statistical analysis before I get to the results. We created a risk surface measure to understand the co-occurring risks. We're calling this the social vulnerability aspect. The process was to rank all census tracts in the city according to their degree of similarity, with the most vulnerable tract, the tract with the worst scores across all of those independent variables that I just showed you. The risk index was comprised of tracts with the highest level of risk based on the shortest distance to the most vulnerable tract. We also created a temporal measure where we aggregated daily counts of CAN incidents and merged them with the mobility measures. We also created indicators to measure the effect of key policy implementations. For example, the date in which the Safer at Home order was issued, the date that the federal stimulus was distributed, etc. This is our model, and just to kind of help you understand what all of these symbols mean, the dependent variables, the number of CAN cases on any given day, day T. The term AXT refers to the mobility index. We created a dummy variable for the 4 policy intervention dates. And then to account for seasonality or seasonal effects, we included an indicator for day of the week and also for week of the month. Of course, there's also an error term built into the model. In terms of the workflow, we first downloaded the incident cases, explored the distribution of CAN, child abuse and neglect, across LA County. We incorporated the administrative boundaries. Then we created the space-time cubes using the NetCDF format, which aggregates space, time, and the incidents. After a number of iterations, we settled on a 5-city block, 1-month interval specification. We then visualized the space-time cubes and created the emerging hotspot analysis. In step 2, we used the social vulnerability indicators, that is the birth assets from the CASI, the California, I forgot what it's called, the acronym, but the California measure: chronic absenteeism, unemployment, housing affordability, mobility, and poverty. Then we created the risk surface analysis, explored the risk surface with a series of maps, and then in step 3, evaluated the risk within new child abuse and neglect hot and cold spots. So onto the results, that is the temporal trends, the emergent hotspots, and the predictive factors effects. This is the first table of results in the paper, and I just want to highlight the most significant results. This table is the individual and contextual similarities and differences of abused and neglected children pre and post-COVID. Pre-COVID is in the left column. So I'll just highlight the most significant results. The first is most child abuse and neglect cases involve children of color, highlighting its role as a civil rights crisis. The way child abuse and neglect is perpetrated involves something other than a strong arm method in about 40% of the cases. There were significant differences in the location of child abuse and neglect before and after COVID, respectively. 5 neighborhoods accounted for between 44 and 52% of child abuse and neglect incidents before and after COVID. And on average, there were 3.71 and 3.28 child abuse and neglect incidents per day before and after COVID, respectively. As for the temporal trends, pre and post or during COVID, we found an 8% decrease in CAN reports during the pandemic. That was statistically significant decrease overall across the city, but we did not find statistically significant differences following the 4 policy interventions, and we found no statistically significant differences during school hours or as a result of changing mobility patterns. So these things had no effect, for example, on CAN incidents, either before or during the pandemic. And the chart here, the red line is pre-pandemic, and the green line represents the time trend during the pandemic. This is the map on the left. A is the census tract ranking of co-occurring risk factors that indicate areas of highest vulnerability. Despite the decreasing overall trend, we found that by doing the emergent hotspot analysis, we found that many areas actually deviated from this decreasing trend, which is quite significant. Specifically, 339 hotspots of CAN were identified that were categorized into 3 patterns. 15 were new hotspots, 12 were intensifying, and 201 were consecutive. It's important to understand what these hotspots are actually measuring. A new hotspot is a location that did not have a high case before COVID. An intensifying hotspot refers to an area where the number of CAN cases increased over the time period. And a consecutive hotspot is an area that had continuously high numbers in recent months. So all of these were of concern because of how we parameterized the model, with the last time step referring to COVID-19 time period, are of major concern during COVID-19. So these are the areas of major concern. There were also 669 cold spots, 17 were new, and 652 were consecutive. So we can see where these different hotspots are on the map. And by juxtaposing the maps, we can see that the areas with the highest risk, that is, had more vulnerability, were also areas identified as consecutive, intensifying, and new hotspots during COVID-19, whereas those associated with the cold spots are in areas of extremely low risk. This is the negative binomial regression results, and I'm just going to highlight some of the more important findings. All vulnerability factors strongly associated with CAN incidence. Chronic absenteeism and severe rental burden had the highest impact, and CAN incidence is higher in intensifying and new hotspots compared to consecutive cold spots, which is a result that we would expect. This chart shows the predicted number of CAN incidents between and within hot and cold spot across ranges of social vulnerability. And again, just to highlight a couple of the key findings, all social vulnerability indicators had a large effect on predicted CAN incidents, especially in intensifying hotspots. But if we look between the hot and cold spots, we see that intensifying hotspots had lower values across all social vulnerability indicators. And if we look within hot and cold spots, we see that lower levels of social vulnerability predicted higher CAN incidence for all measures. So just to summarize the key findings quickly, we see that overall child abuse and neglect decreased pre and post COVID. That's reflected via the overall time trend. However, we note a lot of temporal and spatial heterogeneity that is elucidated by the space-time trends and the emergent hotspot analysis. We found cold spots that were new and intensifying. These represented low counts pre and post COVID, and they were in areas of low deprivation. Importantly, because we looked at this over time, we were able to know that this is not a cold spot because of COVID, but this has historically been a cold spot. Similarly, we found new consecutive and intensifying hotspots. These were high counts during the pandemic, and they were all in extreme areas of extreme deprivation. So new and increasing hot and cold spots of child maltreatment are situated directly in the context of overlapping community risk and protective factors. Even though CAN decreased across the city, several areas showed increases, specifically during COVID-19, and these influences were all in areas that were most vulnerable. A few takeaways in terms of policy implications. The results suggest the need to reframe child maltreatment as a public health or civil rights problem. That is, identifying neighborhood structural vulnerability is a key aspect of prevention, and it's important to understand it as a civil rights problem because violations of the law have legal remedies. It's useful, I should say, to examine spatial dependence and heterogeneity to target potentially harmful situations because the co-occurring risks seem to be relatively more predictive than a single risk factor alone, for example. So prevention should address the diverse and interrelated contexts in which CAN happens. I think that important policy implication is that the need to broaden the ACEs framework to include more individual and spatial disadvantages and assets. There's a lot of literature on individual level ACEs, but there's not any literature on the spatial context in which ACEs happen. And then finally, it would be useful to center discussions on economic inequality rather than simply poverty or exclusively poverty as a risk factor, because gradients of socioeconomic status matter more than simple poverty thresholds. Jane, am I doing okay on time?
You're doing great, Gia.
Okay, so I was just going to suggest a few directions for future research. I think that there are a lot of novel applications in the realm of geospatial analyses that can be useful for CAN prevention. And this paper kind of has gotten me thinking about those. So I was just going to share a few directions for future research. One of them has to do with understanding what I'm calling socially connected neighborhoods and activity spaces in the context of child abuse and neglect, starting with historical circumstances, laws, and policies, the redlining, the racially restrictive covenants, how that has led, for example, to social exclusion and gentrification, and also importantly, influencing social structures, physical structures, and interactions and exposures. The physical structures are something that has not yet been introduced into child abuse and neglect research. So the role, for example, of the topology and morphology of an area, and how the social structures and physical structures, along with exposures, influence the neighborhood characteristics that we think is associated with the problems of risk as related to child abuse and neglect, and suggest a few research questions that can be used by applying geospatial and geostatistical analyses to further child maltreatment prevention. So for example, does child abuse spread through a process of contagion is a question that is best addressed with these methods. And just, well, not to go into this a lot, but just to say that the idea of spatial networks and sociospatial networks in child maltreatment, along with understanding the accessibility of amenities, the role of gun violence near schools, for example, it plays in harming children. All of these are very well addressed and suited to questions of geospatial, spatiotemporal analyses. And with that, I will field any questions that anybody has. Thank you so much.
So much, Gia, for that really interesting work. And I want to thank you for including one, policy implications, because again, we have a lot of frontline responders and policymakers with us today. So I do appreciate you adding that. And I also love that you included future research opportunities. I think that's important. Where does this research go? How does it live on? So it doesn't stop with this paper. So thank you so much for including those.
Thank you, Jane.
So I want to invite our audience members to type some questions in Q&A. I do have a few that have come through, so let me start with these. The first one, Gia, is what structural risk factors are most salient for child maltreatment prevention?
Oh, that's a really good question. I personally believe that housing and food insecurity are those factors that are most important. And the reason that I believe that is because I think that neglect in this country, the way neglect is legally defined, is in a tautology with poverty, right? It's synonymous. And so if we really were interested in eliminating child maltreatment, it would seem that we would be preoccupied with getting particularly single mothers into secure housing and in households that are food secure, so that they will not by definition be deemed neglectful. So I think those are two structural vulnerabilities that are very significant and have substantial historical origins in this country.
I appreciate your perspective, and I think for our audience, that's a very important point, as some are from very low resourced areas. And the effect that has on child abuse and neglect is important to recognize. So our next question is, how is a public health perspective different from other approaches? Like, for example, criminal justice approach?
Well, good question. So criminal justice is justice oriented. and is really concerned with upholding the law and with punishment. I think a public health perspective understands that inequality is the principal source of disparity across many different social domains. And the focus is really on prevention and preventative interventions that are grounded in community. And so criminal justice, unfortunately, and these are not mutually exclusive, they can be well integrated, but sometimes the focus is more on after the fact, things that occur, and we're punishing people. And I think that the punishment is where I have the problem, because I think it doesn't work the way it's intended to work. So if we focus on preventing child maltreatment or child abuse and neglect in the first place, by making sure people have access to resources, then we don't have to, we only worry about the most severe cases, right, after the fact.
Anita in the chat made a reference to Maslow's hierarchy of needs. Any perspective on how that relates to what we're talking about?
I was involved in a community-based project on youth violence for several years, and the idea of the hierarchy of needs and the three hots and a cot, right? The idea that youth basic needs are not met, and we cannot begin to layer any other kind of intervention on top of that. How can we expect youth to not drop out of school when they're going to school hungry and they can't concentrate? So it's critical to start with the basic needs perspective, because without that foundation, nothing else we do really matters. So yes, that's a really important point.
Perfect. Thank you for addressing that. And I have a question to you. I'm always curious, what motivates you to do this work?
Thanks for that, Jane. The first motivation really came from that transformative project. I went into this project on youth violence doing an evaluation that helps to understand why youth drop out of school. And I basically reframed the whole thing, not only from a public health perspective, but even the question asked, how do we expect youth to stay in school when, again, their basic needs aren't being met? And so it was again transformative for me, because I could not believe how youth, and it was in Boston, were being substantially affected and impacted by violence, even on their routes to school. At the same time, I have 6 children of my own, and my husband was diagnosed with a terminal illness and eventually passed away. And the effect on my children was huge. And so even though I'm a political scientist, I changed my whole research orientation to studying adverse childhood experiences and their long-term effects on people, noting, for example, that the current ACEs indicators are not representative of me and my family. Death of a parent, for example, is not one of the typical ones. Poverty is not a typical one. Housing insecurity and violence exposure. And so I've really made it my mission to address how, the context in which youth development happens and how we can change outcomes in the long run.
Thank you for sharing that personal story. And I'm sure I join others in really telling how sorry we are for your loss and how that affected you and your children.
Thank you. Appreciate that.
So we have some more questions coming in. This one is from Bagnus. It says, do you think social protection will have a role to increase social protection in this case? Bagnus, do you understand the question? I want to make sure.
Yeah, could you repeat the question, Jane?
Sure. I think maybe I might need you to retype, Agnes, in case we're not reading it correctly. It says, do you think the social protection will have a role to increase social protection in this case? Agnes, I'm going to have you retype that potentially, unless Gia, what answer he's looking to get. Okay. Yeah. If you want to retype that, we do have a question from Bridget too. It says, I appreciate the attention to the social structures and contexts over and above family level poverty. Did the Strong Start Index measure any community level constructs or just the tract level aggregation of individuals with a given characteristic like poverty?
So the CASI has 4 different indices in it, attempting to measure assets at birth, particularly of the mother. So whether the mother was a teenage parent, whether the birth was premature, they're really meant to be indicate, like the neighborhoods that have the worst scores on this have the highest levels of removals from the home and child welfare involvement. Then there were other economic variables as well, including measures attempting to get at economic vulnerability. So it was fairly broad. It was not just meant to capture poverty. I hope I answered that.
Okay, thank you. And Magnus, if you want to retype your question, I can send it to Gia. But at this point, I wanted to thank you. Is there any takeaways you would like to sum up for us? Or it was a wonderful presentation and very rich data and useful data.
Thank you so much, Jane. Would love to continue these conversations with anybody. My email's on the PowerPoint, and thank you all so much for attending.
And just to congratulate Gia, her abstract was accepted for our Edinburgh Congress. So she will be joining us at our ISPCAN International Congress in Edinburgh in September. So hopefully many of you will join us as well. But congratulations on that. It was a very intense selection process. So again, it speaks to your great work. So thank you, Gia.
Thank you so much.
So now I'd like to introduce our second paper, Using Social Media Data for Assessing Children's Exposure to Violence During the COVID-19 Pandemic. There were multiple authors on this paper, but today it will be presented by Claudia Kappa, Senior Advisor for Statistics and Monitoring in the Data and Analytics section at the UNICEF headquarters. Claudia is the focal point for data collection, data analysis, and methodological work on early childhood development, child disability, and child protection from violence, exploitation, and abuse. In this capacity, she has led the preparation of several data-driven publications and is responsible for interagency collaborations and partnerships. Prior to joining UNICEF, she was working at the University of Geneva and at the Institute for Social Studies of the International Labor Organization. Claudia holds a master's and a doctorate in developmental studies from the Graduate Institute of International and Developmental Studies in Switzerland. Joining her and presenting today is Dr. Carlo Lipizzi, a professional in the field of machine learning and data science with experience in both academia and the private sector. He currently serves as an associate professor at the School of Systems and Enterprises at Stevens, where he conducts research on data science, AI and machine learning, and natural language processing. In addition, he's the director for the Graduate Program in Engineering Management and System Analytics, and serves as the director for the Center of Complex Systems and Enterprises. Dr. Lipizzi holds a PhD in system engineering from Stevens, as well as an executive management degree from IMD in Lausanne, Switzerland, and a master's in mathematics from the University of Rome in Italy. He's leveraged his extensive 25 years of international experience in the information technology, communication, and management consulting industries to develop a consulting practice on AI, ML, and NLP. And at this point, I'd love to turn it over to Claudia and Carlo.
Thank you so much, Jane. Good morning, good afternoon, good evening, everyone. On behalf of UNICEF, I wanted to start my intervention by thanking the International Society for the Prevention of Child Abuse and Neglect and the Journal of Child Abuse and Neglect for giving us the opportunity and the honor to present the work that we have done. We are really grateful for your participation in this webinar and for overall having indicated your appreciation for the paper that we produced together with Stevens University. And it's the second mention I wanted to do today is really in recognition of UNICEF gratitude to Stevens Universities for having joined hands with UNICEF at the beginning of the pandemic, when as an organization working throughout the world, promoting the rights of children, we were, of course, like many others, very concerned about understanding the impact of the COVID-19 pandemic across several indicators of well-being for children. But particularly, and this is where my focus area is, we were very interested and eager to understand throughout the world what was the impact of COVID-19 to children exposure to violence, exploitation, and abuse. We, of course, we were very concerned about the anecdotal evidence coming in from our UNICEF country offices throughout the world. UNICEF is operational in several countries through our programs and our activities on the ground, but also in high-income countries through our national committees, where we intervene at the level of the advocacy, for example, and more broadly in support to certain specific interventions. And we had, of course, been notified very soon, very early on a number of indications that violence was increasing. But as we know, many countries still lack prevalence data on how widespread violence against children is. And in the times of COVID, the regular methods through which we collect data on the prevalence of violence against children, which obviously comes from household surveys when it comes to understanding the size of the affected population, were not working anymore. They were disrupted to the same extent as access to services. Hence, UNICEF desire to bring together experts and across a number of disciplines to come together and say, okay, we cannot use our traditional way of collecting data. So what can we do using other data sources other than surveys or other approaches to try to get a sense of whether or not the experience of violence has increased, or the risk factors that then are linked to violence against children have been triggered by the COVID-19 pandemics. And we started talking to experts, and this is where the collaboration with Stevens University has become critical. They volunteered to join hands with UNICEF in bringing their incredible expertise, but also passion and commitment to children's rights, to make use of the available data and then support UNICEF in this attempt to understand what was happening in the world. So here I want to stop because, of course, from UNICEF perspective, I just wanted to have an opportunity to situate this project within a larger concern that UNICEF had back in 2020. And now I'm going to give the floor to Dr. Lipisi, who has been leading the team from Stevens University that contributed to this article. Over to you, Carlo.
Thank you, Claudia, and thank you, the organization. I join Claudia in thanking you for the opportunity that you are giving us to present our work and to spread the results of our research. So I would start sharing my presentation. I hope you can see the screen. Briefly, Claudia was mentioning the UNICEF team is Claudia and Nicole. We worked together for several months. It was a great experience for sure on our side, but from what here from UNICEF side as well. So we are trying to find other opportunities to work together again. That's the team on our side. So it's myself, and then we have Dr. Jose Ramirez Marquez working in the same school where I am, that is the School of Systems and Enterprises, is more focused on resilience analytics and urban analytics. And then two, at that time, PhD students of ours, Puria Bavei and Fernanda Capella. They are now both out of the university in leading positions, actually, in data science and machine learning. So we are grateful to have the opportunity to work with them. Going into the goals, for sure, the introduction that Claudia provided gave you the context of the reasons for doing the analysis. So we focused on children abused and in cyberbullying occurrences. And we focused on social media. So when you do any work on data, the role of data is essential. So data science is no science without data. The way you pick the data, the way you trigger the events, the way you clean the data, you prepare the data is essential for showing the proper results. We focused on social media for the reasons that Claudia mentioned before. During pandemic, but probably in general, it's very difficult to trace events or occurrences or events like the domestic violence or children abuse. Some of the people tend to be more reluctant to go through official channel, while we are more and more open to open ourselves in social media. So we all have a sort of a virtual life that we spend on different channels of the social media. Could be Facebook, could be Twitter, could be Reddit, could be Instagram, or any other across the world. We wanted to focus not on one single region of the world, but more on different countries, basically to see if it was something that was happening only locally or was more, worldwide. When you work with text in general, there are a million issues. So I'm working with natural language processing since several years, and I'm encountering pretty much all the time the same issues. Most of the time you have a lot of data. So when you work with social media in particular, you have a huge quantity of data. And you need to be selective. You need to discriminate what is good and what could be really contributing to the results and what could not. So some data may be misleading. So it could be saying something, intending something else. It could be misinterpreted in many different ways. Then social media, social networks are great, but the penetration is not equal across the world. So in some underdeveloped countries, the penetration is lower, meaning they are less representative. And then, like in any other context, obviously, victims are not comfortable or may not be comfortable in discussing their experience or experiences with anyone else, and in particular with a group of social media friends. And then there are issues that are related to the language. So we want to go cross-language, but when you analyze text, language matters somehow. So you need to take into account that there are differences in terms of word, meaning the same word can have different meanings, but there are differences in terms of culture. So there are different ways cross cultures to express the same point. We didn't go that much deep in this second aspect because that's a real whole different level of complexity. So we took into consideration the difference of languages, but not the differences of culture. We focused on two social media, Twitter and Reddit. So they are social media, both, but they are very different. I used tweets for many research. Before the current ownership, it was the place to go to get feedback on facts, events that were happening in real world, sort of back channel for real world. They are typically short messages. They may not be very focused. They are unstructured, so language is becoming more and more unstructured, and tweets are a good expression of it. So limited number of characters, lack of specific focus, but wide distribution. I mean, tweets, there are billion tweets each day, I would say, expressing I mean, reaction of people to given topics. Reddit is completely different, is more specific of specific topics. So you have subreddits that are collections of opinions on given topics, meaning while tweets may be unfocused, Reddits are focused, I would say, by definition. So the time frame was pretty much the same, and it was a little bit before and during the pandemic. We used a multilingual model. We trained the model using 100,000 tweets for, I mean, that's for the training portion. And we use a topic modeling method that it's kind of was at that moment the golden standard for the topic modeling. So two case studies, two different social media. The first one is using Twitter. So again, it's widely used for academic research, but in marketing as well, and in many other different analysis. In tweets, you have an indication of geolocation. It's not 100% reliable, but it's reliable enough on the big numbers. So if you go on the individual tweet, may not be significant, but considering the number of tweets you have, overall will give you an indication. It's definitely one of the most popular social media platform in the world. It's text-based. You can get some statistical values out of text. So when you do text analysis, you can do statistical, you can do syntactical, meaning analyzing the structure, and semantical, meaning the content. We obviously focus more on the semantical aspects, but the first one, the statistical, was interesting to give us some preliminary indication. Again, while Twitter is not a real conversational platform, when is focused on one particular topic, the conversation is kind of converging, meaning can be used to get the feedback on something. So the methodology that we followed, we collected the tweets with keywords. So we defined keywords that may be relevant to our analysis. We filtered using the training model that we developed, those that are really focused on the topics of the analysis. We mapped the results by community, and then we do the analysis. Some very early results. So before, after COVID, so we ranked the area with the highest increase. District of Columbia had the highest increase before and after the pandemic. Keeping in mind that we were, I mean, at home all the time, meaning the activities that we had online had an increased value by probably an order of magnitude. So we discounted that. So in particular on Twitter, we noticed a 24% increase in engagement in the platform that was actually announced by Twitter. So we discounted that. So that's a before and after, and those are the top 10 states in the US. Some of them, again, District of Columbia had a huge increase on tweets related to hate speech. Again, the result is discounted, and this is relevant because otherwise it wouldn't get much of interest. This graph is basically representing the difference between abusive and non-abusive content in the tweets across countries. So some countries, the number of abusive tweets were definitely more than non-abusive. We have Sweden that is an exception. But pretty much all the countries had an increase on abusive content. For some countries was more evident, other countries not so much. So we will go with more details on that. We now wanted to see if there are some correlations between some factors and the increase of abusive content. We use two indexes, the stringency index that was developed by University of Oxford. That is a way to measure how strict were the policies in one given country. The policies for containing the pandemic, meaning how strict was the lockdown, how strict policies in general, school closures, restrictions on movement, but also income support and everything that is related to the healthcare system. So the University of Oxford created this stringency index that is a composite index that is considering those elements. Then you have the Human Development Index. That is a widely used index. Is another composite index that it considering the life expectancy, the access to education, and the standard of living. So those two indexes, we wanted to see if there was a correlation between those two indexes and the increase in abusive content. So we find out that there is no major correlation between the stringency index and the increase in hate speech content. But there was a pretty high correlation with the Human Development Index. So that's another factor. Again, there could be several ways of reading those results. The stringency index being non-correlated could be an indication for whomever is deciding the measurements, like lockdown or healthcare components of the remediations for a pandemic. Human Development Index, that's unfortunately something that is expected. So again, if you look at Sweden, that is at the bottom right, that's kind of an indication, as well as Kenya on the opposite side, or Indonesia even more on the opposite side. So that's basically on the Twitter side. On Reddit, again, Reddit is probably not as popular as Twitter or Facebook, but has the big advantage of being very focused, very related to the given topic that is the subreddit where people is posting their content. Sometimes we notice that the community of people posting on those subreddit are sometimes working as a sort of a support community. So it's really more of a community side. So you need to subscribe to the Reddit, meaning there is an active role that you are playing. So we focused on specific subreddits. So Reddit is overall, subreddit are like channels. The channels that we followed was abuse, survivors of abuse, and domestic violence. We also use some control groups that are not directly related to see if we can we can adjust the results based on something that is not strictly related. The time period was similar. Limitation, Reddit is quite popular in the US, not so much at the international level. So that's an example of one of the messages in one of the subreddits. So some of them, most of them can be dramatic. So process kind of similar. We collected the data. Obviously, when you work with text, there is quite a lot of data preparation that I didn't mention, but it's taking a good portion of the time of the developers, of the data scientists working on those media. So we selected the subreddits, we collected the posts, we clean them, then we did a temporal analysis, because again, time is essential to see how the whole phenomena was developing. Then we extracted topics and we mapped the the topics in time. So that's basically the distribution of new posts in those subreddits. Needless to say, there was a spike after the pandemic, so that's the trend. That's a number of members of different subreddits. So we did this analysis to create a sort of a context. Relationship advice, off my chest, anxiety, depression. So those are growing more than meditation, than autism, that are obviously very serious problems, issues, but less growing than those that are more abuse related. The topic modeling was done automatically reading the text and using LDA, that is a statistical method for extracting text to cluster somehow the topics in a given number of topics. So we define, we started with a large number, and then based on how big the different buckets were, we reduced the number to 5 topics. So that's a graphic representation of the different topics. But then we wanted to populate those topics to get an idea of the classes, somehow clusters of the content of those topics. So the 5 clusters were intimate partner abuse, that is the largest, physical abuse, sexual abuse, child abuse, practitioners support. And the keywords you can see on the right side, for example, physical abuse, that is 22% of the total, grab, car, door, throw, punch. So those are more related to physical abuse. That means that Reddits with those keywords will go into that category, that bucket. That's the distribution in time. So number of posts for each one of the 5 groups. So fortunately, the practitioner support is growing, but unfortunately, is not the fastest growing in the group. Again, intimate partner abuse is the one that is speaking the most. So some key results, 33% more exposure to abusive language and cyberbullying on Twitter during the pandemic. 37 US states saw a larger increase in tweets containing abusive language. The growth of abusive language and cyberbullying is more significant in developing countries. So that's the correlation that I was mentioning in a few charts ago. Low correlation with the stringency index that is somehow related to the stay-at-home policies in different countries. 94% more child abuse reports on Reddit, 88 more intimate partner abuse report on Reddit. So those are the key findings on our paper. And again, open to your questions. And again, we really thank you for the opportunity that you gave us to present the results and be here and be recognized for the work we did. Again, thank you all.
Thank you, Dr. Lipizzi. I'm going to ask that any questions for Dr. Lipizzi and Claudia go into the Q&A box, and they'll be able to answer those directly to you. For sake of time, I want to give due diligence to the next paper. So again, we appreciate your presentation. Please make sure that you type your questions in the Q&A. And Dr. Lipizzi, if you could answer them there, I'm sure our audience would love to get some additional context from you. Thank you very much.
Thank you.
And now I'd like to present our final paper, which I'm also very excited about. This paper has just such rich content as well. It's Violence Against Children During COVID-19, Assessing and Understanding the Change in the Use of Helplines. In addition to Claudia Kappa, presenting this paper is Nicole Petrosky, Statistics and Monitoring Specialist in the Data and Analytics section at UNICEF headquarters. Since 2011, Nicole's provided support with data collection, data analysis and methodological work on early childhood development and child protection from violence, exploitation, and abuse. These activities include the development and validation of survey questionnaires, data collection tools, methodologies and guidelines, productions of estimates and data analysis, preparation of reports and other dissemination materials, and capacity building. Nicole has a master's degree in development psychology from the University of Toronto in Toronto, Canada. And at this point, I'd love to turn it over to yourself and Claudia.
Thank you so much, Jane. And again, it's my pleasure also to open the third paper, or the second produced by UNICEF. In this case, it was a collaboration with Child Helpline International. So just to give a couple of introductory words, and Nicole, if you can kindly put it in a presentation mode. So the idea stems again from the initial concern that I talked about from UNICEF side. And as we were exploring, for instance, social media data, we also decided to see to which extent we can use available data coming from Helpline, for example, to have a sense again of the impact of the pandemic. So today it's me and Nicole presenting, but of course I also wanted to acknowledge the other authors, Andrea Pereira, Helen Mason, and Rocio Aznar-Daban, Andrea and Helen from Child Helpline International, and then Rocio from our UNICEF team. So going now to the research question is again, how has COVID-19 impacted the prevalence of violence against children? And of course, we heard coming from mostly news outlets that there were continuous reference to cases of abuse and neglect increasing during the pandemic. But most of the news outlets were reporting anecdotal evidence or evidence coming from service providers. And of course, and this is where we can go to the next slide, we know that the COVID-19 pandemic triggered a number of risk factors for violence against children, increased tension in the house, additional economic stressors on caregivers, job loss, social isolation, economic uncertainty, and all of these factors are known to have an impact on the level of violence against children. We also were concerned about reduced access to services through, for instance, disruption to school attendance, where we know that schools can be an entry point for reporting cases of violence against children, and other services as well. But of course, and we can move to the next slide, we know that assessing, as I mentioned earlier, children's experience of violence require baseline figures. So if we want to measure change, we have to have a baseline, right? Change compared to what? And throughout the world, we're still lacking not only survey data, but also service providers data coming from administrative records that give us a sense of access to services. And of course, with the understanding that information about access to services should never be interpreted as an indication of the prevalence of violence against children, because they're not meant to provide an estimate of how many children are affected or are exposed to violence. They only provide information about service delivery, service outreach, and the ability of the service to deliver to children. So there was also a lot of confusion and mixed messages going out at the beginning of the pandemic, taking the service provider records as an indication of actual changes in the prevalence of violence against children. And we know that when these service provider data go up or down, they can both be indicative of something worrisome. Because if you have a sudden drop in the reported cases of child abuse through the school system, this might be simply because, for instance, there is no longer the possibility of teachers or other caregivers to be in contact with the victims. Similarly, if there is a drop in the reported cases of violence through the police or through the health system, again, is not necessarily an indication that the violence is going down. So we wanted to specifically, with the second paper, focus on service deliveries, particularly through the help line, because they were the least disrupted of the child protection services that were reported throughout the world. This is essentially the background to the paper. And then I wanted to give now the floor to Nicole, who is going to guide you through the actual findings. Thank you.
Great. Thank you, Claudia. And I'm so delighted to be here as well and really appreciate, and I'm very grateful for the recognition of the work that we did. So as Claudia mentioned, we wanted to find a way to be able to make sense a little bit of some of the reports, especially in the media, that was coming out about, concerns around an increase in terms of levels of violence against children as a result of the pandemic. So the purpose of the paper was to try to document what had occurred and actually been reported to child helplines during the COVID-19 pandemic. And then in light of this, tried to discuss what are some of the implications, as Claudia was talking about, some of the implications for using data from service providers to draw conclusions and make inferences about truly what was the impact of the pandemic on violence against children. And we had two approaches for looking at these questions. The first was to analyze data coming from a survey of child helplines that was conducted by the co-authors at Child Helpline International. And Child Helpline International, it's a collective organization of children's helplines from over 100 countries and territories around the world. So it's a member organization of children's helplines, kids help phones that exist in over 100 countries around the world. And what Child Helpline International did was reach out through their network of child helplines and ask their helplines to provide them data and report about contacts that they had received during certain periods of time. So the helplines were asked to provide data and the actual number of contacts that they received either directly from children, so children themselves contacting the helpline in one way or another, or contacts that had been received from adults who were contacting the helpline about an issue concerning a child. So it could be, for instance, a teacher who contacted a helpline, to report a suspected case of abuse, for instance, of a child in their classroom. And they were asking, through the survey, they asked about contacts that had been received to the helpline through any outlet. So it could have been via a phone call, through an internet chat that's set up, for instance, on the helpline's website, an email, so through any of the different outlets that the helpline might have in place for receiving contacts. And they did the data collection through 2 rounds. So the first round of data collection, they asked the helplines to provide information and data about Q1, so the first 3 months of 2019 and 2020. And 71 helplines among their member organizations provided information. So this is helplines that exist in over 60 countries, and this is the equivalent of about a 53% response rate. Then they did a follow-up round of data collection to ask the helplines to provide data on contacts that had been received in the second quarter, so that the next 3 months of both 2019 and 2020. And there we were able to get data from 49 helplines from around 46 countries, and obviously a slightly lower response rate. So the response rate between the first round of data collection and the second round of data collection had dropped quite a bit. So the analysis that we're going to be presenting today and that we prepared for the paper is based on data that came from 48 helplines, which exist in 45 different countries that had what we considered complete data. So these were helplines that had provided data for essentially the first 6 months of both 2019 and 2020. And we focused our analysis only on what we defined as counseling contacts. So these were contacts that were made to the helpline where there was a request for advice or guidance, or the counselor, for instance, made a referral to the person who was contacting the helpline. So we filtered out contacts that were, silent, where there was, no one on the other end of the line, for instance, or contacts that were abusive. So the analysis is a subset of the contacts that were specifically tagged as being counseling in nature. Then the second method or second approach that we used was to take a look at the media reports. So we did a Google search of articles and news stories that had been published essentially in the first 6.5 months of 2020 using a combination of different key search terms. We identified about 70 articles that met some basic inclusion criteria that we had set up. And these articles documented some data or statistics that were coming from about 26 countries. About half of the articles that we identified included some sort of data or statistics about reports that had been made to child helplines or hotlines reporting suspected cases of child abuse. So these were articles that were documenting, again, contacts that had been received to child helplines or hotlines. And then the other half of the articles, they included statistics about reports that were made to helplines or hotlines that were dedicated more to domestic violence or violence against women issues, or that had been made to generic helplines, so not specifically child helplines or hotlines. And then in order to contextualize a little bit more the findings and the analysis that we did on the helpline, on the survey of child helplines, we used a measure called the Stringency Index, which was developed by the University of Oxford to measure the severity and the strictness of stay-at-home orders that were put in place as a result of the COVID-19 pandemic. It's a composite index measure. It's built on 17 different indicators, and countries are essentially assigned a score between 1 and 100, with scores closer to 100 indicating that the government had put in place more strict policies around containment and stay-at-home orders in response to COVID-19. It's not an indication or meant to be interpreted as an indication of whether these policies are appropriate or whether they were effective in terms of the country responding to the pandemic, but really a measure to be able to sort of equate countries to each other in terms of the level of strictness of the types of orders that have been put in place around containing. So first, we'll go through the results from the analysis that we did of the survey of child helplines. So in this chart, we have the number of contacts that had been received by helplines in the first 6 months of 2019 and in the first 6 months of 2020. And these were contacts that had been received by the helpline for any reason. So it was just where, again, it's a counseling context. So where there had been an interaction between the counselor and the person contacting the helpline, and the counselor had provided some type of advice or guidance or a referral, for instance, but it's a contact for any reason. So the person had contacted the helpline, not necessarily about violence or abuse, but essentially for any reason. So what we can clearly see here is that there was a marked increase in the number of calls that helplines received for any reason in the first 6 months of 2020. So between January and March, and then April to June, there's a marked increase, about a 35% increase in in the difference of calls. And obviously this is a change that happened, in within the context of the pandemic. So of course, the first 3 months of 2020, things were just kind of coming to the forefront. And then around March is when it became really a global pandemic and a global issue. And you can see, of course, then there was a marked increase in the number of contacts that helplines were receiving in comparison to the first 6 months of 2019, where essentially there was no difference in the number of contacts that had been received. It was more or less the same level. So clearly, people were reaching out to helplines, to child helplines more during these first 6 months of 2020, again, for any reason. Then we were also able to analyze whether the contact that had been received by the helpline was specifically being made in relation to COVID-19. And obviously this data is only available for the 2020 time period. So the data in this chart is showing the number of what are called COVID-19 related contacts that were received by the helplines in the first 6 months of 2020. So you have the data, the number of contacts by month here. And a COVID-19 related contact was considered something where the person who had contacted the helpline made either direct or indirect reference to COVID-19, or there was some sort of association to the reason why they were contacting the helpline in relation to COVID-19. But it could be related to COVID-19 for any reason. So for instance, they could have just been reaching out to the helpline to get information about what is COVID-19. So it was a contact that was made to the helpline for some reason related to COVID-19. So we can see here, of course, again, like I said, after March, when the pandemic became a real global issue, there was a marked increase in the number of contacts that were tagged as being COVID-19 related that these helplines were receiving. And then we saw a little bit of a decline in the number of contacts received after April. We were also able to look at the reasons why people were contacting the helplines about COVID-19. And the data had indicated that the number one reason to seek COVID-19 related, or for a COVID-19 related contact in the first 3 months, so from January to March, it's people were contacting to get information about COVID-19. So they were asking questions like, what is COVID-19? How can I protect myself against COVID-19, et cetera. From April to June, the top reason for contacting the helplines related to COVID-19 changed, and it was actually more about accessibility issues. So people were starting to contact the helplines about COVID-19 more to express concern or issues around accessing services. So I'm having trouble accessing this or that service because of COVID-19 closures or disruptions. Then we had data from a subset of helplines where we were able to look at the number of, again, these COVID-19 related contacts that then were specifically about violence. So now we're continuing to sort of narrow in and zoom in further. So we started looking at all contacts, then we were able to look at contacts related to COVID. And then now we're able to look at, for again, a subset of the helplines, we were able to look at contacts that were made to these helplines where it was both related to COVID-19 and violence in some way. So they were tagged as being a contact for those two reasons. So in this chart, each dot essentially represents a helpline. And along the horizontal axis, we have the stringency index score. So it's the score for the country in which the helpline is located. And then along the vertical axis, you have the number of COVID-19 related contacts that were made about violence normalized to the child population in the country. So it's the number of contacts per 100,000 children. So the main takeaway from this analysis was essentially that we were seeing a similar rate of calls that were being received by helplines, despite differing levels of differing levels of the strictness of the containment measures and the stay-at-home orders within a country. So regardless of sort of again, the strictness of the containment measures and the stay-at-home orders that were in existence in a country, these helplines that we were able to look at were kind of receiving essentially a similar rate of calls about COVID-19 and violence. Then we wanted to look at and understand, I mean, as Claudia was mentioning, has there been a change? So was, as a result of COVID, was there an actual change in violence-related contacts that these helplines were receiving? Could we look at and could we somehow analyze whether there had been a significant change in contacts that helplines were getting about violence before and after the pandemic? So again, for a subset of helplines, we were able to look at the number of violence-related contacts that the helplines had received, and these were not just those that were tagged in relation to COVID. So this was any contact that the helpline had received that was in relation to violence in some way. So again, on the horizontal axis, you have the stringency index score. So again, that's that measure of the strictness of the containment measures and the stay-at-home orders in a country. And then on the vertical axis, it's the change in the violence-related contacts. And the way that we measured the change in the violence-related contacts was we looked at the average number of contacts in any quarter of 2019. So the average number of contacts for any quarter in 2019 that the helpline got in relation to violence to the second quarter of 2020. So after that, after essentially March, when the pandemic really became again a global issue. And what we found was really a mixed picture. So we found that in some of the helplines, there was an increase in the number of violence-related contacts that they got in the second quarter of 2020 as compared to the average that they would have gotten in 2019. And these are essentially the dots that appear above that red line. But then we also saw in about the same number of helplines, they actually received less. So they received less contacts related to violence in the second quarter of 2020 compared to a quarterly average that they would have gotten in 2019. And then in the remaining helplines, which are the ones essentially that sit along that, more or less along that red line, there was basically just no change. So again, a bit of a mixed picture. Some helplines receiving more calls related to violence after the pandemic in comparison to a time, before the pandemic, some receiving less calls, some no change. And then in terms of the results that we got from the media search, it kind of was confirmatory to some of the results we were getting from the survey of child helplines, in that it was a very mixed picture. So in about half of the articles that we had identified, they were indicating or documenting an increase in calls and contacts that were being received by helplines or hotlines after sort of the period of the pandemic had hit. So this was increase in reporting that to child helplines that were in countries including, for instance, France and India and the UK. There was also an increase in reporting of incidents to domestic or gender-based violence hotlines documented in several countries. So not just child helplines specifically, but also, domestic violence helplines were seeing an increase in reporting, or were documenting that increase in reporting. But on the other hand, again, we saw that some of the articles that we identified seemed to suggest that hotlines were receiving less calls during this period of time, and that reporting of violence to hotlines had actually dropped during those early months of the pandemic. And notably in the United States, there was, we found in one of the articles that we looked at, a decrease in reporting to child abuse hotlines in 19 different states. So again, this mixed picture, some saying we're seeing an increase in calls and contacts to helplines, some seeming to document less contact and less calls being received. Now I'm going to hand it back to Claudia to give some concluding remarks and implications.
Thank you so much, Nicole. Since we are already over time, I'm just going to be very quick in saying that, as Nicole mentioned, there was lack of baseline data, make it very difficult to measure change. So as we think about building back stronger from the pandemic, really investments have to be made in strengthening the administrative records in particular, because these might be the only opportunities, or at least the only type of data sources that might remain operational when, for instance, surveys can no longer take place. So really investing in these records and making sure that service understand the importance of keeping these records updated and of quality is really critical. There is a mixed picture, but as we were saying earlier, that's what is expected when services are disrupted. And the increase in the overall contact to helplines, even in cases where this increase is not really indicative of an increased violence against children, but an increased outreach to helpline, it's an indication that these services are a critical lifeline for many children and women at all times, but particularly during times of crisis. And therefore, it's really important to start to think about innovative solutions to facilitate access and improve connectivity and raise public awareness of the existence of child helplines so that they can continue to operate, obviously at all times, particularly when there is a public health emergency. So I'm going to stop here and apologies for going over time, and thank you so much for your attention.
Thank you to both of you. Again, I think I do want to ask just a quick question. I know we're over time, so I understand if people need to drop off, but I guess my biggest question is, were you surprised by the findings? Did you think that you would see this dramatic increase in calls to the helpline based on, countries being in lockdown, and a correlation between this stringency index and the amount of calls? So I guess, where were your surprises? Where were your...
Well, maybe I can start and then Nicole, please come in. I think we were very confused at the beginning of the pandemic. I think the confusion was so overwhelming that we went into this analysis with really an open mind. We were not really sure what to expect. So the findings were, in a way, surprising to the extent where we actually realized that people were reaching out to helpline not because of violence. They were reaching out really on a broad set of topics, which also require adjustment in terms of the training of these helpline providers, because they were all of a sudden asked to answer questions about the pandemic, and where to access service and what was going on in the world. So really, that's where the resilience of the systems needs to be strengthened in times of crisis. It's people reach out on a broad spectrum of topics. So how can we then train very quickly these responders to be able to serve a population that now is reaching out on a larger set of topics? That for me was what. Thank you.
Nicole, anything you'd like to add?
No, I mean, I totally agree. I mean, I think we didn't really know what to expect. And I think that was a real motivation for why we wanted to dig into this, because, we were seeing all these, media reports and everything, and anecdotal evidence that was suggesting that indeed there was an increase in, violence against children and violence against women as a result of the pandemic. And we said to ourselves, okay, what can we do to try to figure out if we can validate this and provide some evidence that if there really is an increase. And that was really the motivation behind the work. Again, as Claudia is saying, because, our normal type of way of getting this information through, in-person household surveys had been completely disrupted and halted during this time. So we were really trying to think outside the box in terms of, what other data sources can we use to try to shed some light on what's going on. We wanted to be able to contribute to that dialogue. So I think we went into it with an open mind, didn't really know what to expect. I think we're a bit surprised, I think I was anyways, that it was such a mixed picture, and hopefully helped, provide additional evidence and context of the need to, look at these things in more detail and not just jump to conclusions as soon as we see certain things increasing, that we don't, rush to conclusions about what that means in terms of people's actual experiences of violence.
Perfect, thank you. And I hope the takeaway as well is that the existence of these helplines when, countries were on lockdown, especially, the very strict countries, it was the only access to help some kids had because obviously the mandatory reporters and the other ways to identify abuse weren't happening because no one was leaving their homes. So the fact these helplines were in place, I hope they evolved to, a level to where it had, should this ever happen again, that access can be, even stronger. Thank you to both of you. Thank you to everyone who joined us. I do want to just share a few slides, but I understand if that we're over time. And so if people need to go, I definitely understand that. I want to just offer the most sincere thank you to our authors for their great work, their time, their dedication to protecting children from harm, their valuable research. And just to acknowledge that your cutting edge research ensures that best practice and quality improvements in systems of care globally can exist through you bringing data to action. For our audience, just a reminder what you'll get from today's session, presentation slides from all authors, a full recording of today's webinar, and an ISPCAN certificate of attendance. And just a few things about ISPCAN that are new and different into 2023. We definitely have a new lineup of cutting edge webinar topics, panel discussions, and training sessions. We hope that you will log on to www.ispacan.org because we have a new, easy to use website. It's user friendly. It has an updated resource library. We are, in fact, in the process of moving our content over from the old site, so it will continue to build and grow with the rich and useful resources that we hope you look to us for. Also, we're introducing a new open access journal. This will be Child Protection and Practice. This will be in addition to our Gold Star journal, the Child Abuse and Neglect, the International Journal, and it will be open access. We have a new member connection system on our new website. It has a fresh look, ease of renewals, networking, engagement opportunities. We'll have working groups and listserv opportunities. So again, as we begin to get the website up and going, I think you'll find that it's very member friendly. And then we are introducing a new International ISPCAN Child Abuse and Neglect Professional Day that will have ISPCAN specific awards. This will happen on July 7th, which is the founding of ISPCAN. July 7th, 1977 is our birthday. We are starting a global health mental health campaign, a global mental health campaign that will have quarterly panel discussions and case studies led by members. We'll have some new youth-led happiness projects and stories of expressions of resilience. We have a new updated strategic plan, more focused on meeting the needs of our members. And we are most excited that we are back in person again, post-COVID. Registration is open for our International Congress in Edinburgh. It will be September 24th to 27th. So registration is open on our website, and we hope that you'll join us. So again, thank you to everyone for being here. Thank you to our amazing authors. And again, we appreciate you engaging with us at this level. So take care, everyone. Have a good day or night wherever you are.